So, Rachel, thank you so much for joining me.
Oh, thanks for having me. Pleasure
It's
to
an
be here.
absolute pleasure to have you. Could you kick us off and tell us a bit about your background and what you do today?
Yeah, sure. So I'm a psychiatrist based in the UK. So I've been working in psychiatry since 2004 after graduating from medical school 2003. I'm based in Edinburgh. I work in a crisis service at the moment for the NHS. But one of my major interests is really metabolic health and nutrition and all things lifestyle medicine, really. So that's me in
That's
a nutshell.
that's super interesting because I've just finished a large portion, I'd say 50% of your book, Metabolic Madness, and it's a real eye opener. And it's fantastic to see a more holistic approach being taken in by some people in psychiatry
Yeah.
around the not just segmenting the body and the brain separately. So, can you tell us a bit about your book, Metabolic Madness?
Yeah, absolutely. Yeah, so I published in July of this year, or sorry, last year now, so 2022. Um, and it's just a real passion of mine. I'd completed training in 2021 with Dr. Georgia Eid, who I'm sure you'll be aware of, many other people will be as well. So she's a Harvard trained psychiatrist who has been practicing nutritional psychiatry or metabolic psychiatry for quite a number of years now. And I forget really where my interest first started, and it's all a bit of a blur prior to doing that course with Georgia in terms of when I first realized that what people eat and their lifestyle choices, in terms of those making a big impact on their mental health. But anyway, completing that course with her just really inspired me to think about integrating those approaches more into my own practice. And I wrote the book really to try to bring the science together for the everyday person who isn't necessarily medical or scientific in background. Because I think really there's there's a large amount of evidence out there now and has been for quite some time. It just hasn't all been assimilated together. Although Chris Palmer is another psychiatrist who's also recently published this year, and the field of metabolic psychiatry is advancing quite rapidly. But my main purpose of the book was to write something that would be readable to the everyday person
Mm.
and to really just give an overview of all the different aspects to metabolic health
Mm.
and how that interlinks with mental health. I should say I've also qualified in functional medicine, so that's partly where my interest has come from as well. So
Okay.
gut health is huge within that
Yeah.
field.
And maybe you
Um,
can tell us a bit about how sort of metabolic psychiatry is different to standard psychiatry, where we often see the brain as kind of separate.
yeah, so I've been trained in the conventional way. So I trained in allopathic medicine, so went to a medical school in the UK in Edinburgh actually, and graduated and then carried on and went into psychiatric training as soon as I could and completed quite a number of years of that to then qualify as a consultant psychiatrist, um, which that was about 11, coming up for 12 years ago now. And nowhere in my training throughout that time did we really place any emphasis on nutrition and certainly not in medical school either. I don't really remember there being any significant amount of training in regard to nutrition. Um, and metabolic psychiatry is just a modern and fresh way of looking at psychiatry in my opinion, and in the opinion of quite a number of others now.
Mm.
But it's not really integrated yet into mainstream practice. So in terms of mainstream practice of psychiatry, it tends to be about taking a history, getting a good kind of patient account and narrative about where the person has come from, what sort of background, what their early life might have been like, and what their physical health is like in general, any other comorbidities that there might be, and then trying to bring the symptoms together to make a diagnosis essentially according to ICD 10 or 11 or DSM 4 or 5, whatever the classification system is in the part of the world that you're living in. And then really the emphasis tends to be on prescribing psychotropic medications, or thinking about other therapies, so psychological type therapies or occupational interventions. Some areas might have a physiotherapist who kind of undertakes a specialist role in their service. But there's not really much emphasis at all, if any, on looking at people's lifestyle, and in particular what they eat, and about their metabolic health.
Mm.
And it's a huge frustration for me, because we know in the field of psychiatry, many of the drugs that we prescribe have adverse effects, and a lot of them tend to be metabolic side effects that people get. So metabolic psychiatry really tries to open up more detail around a person's lifestyle, taking into account their dietary choices and having a think about their metabolic health. And there can be other blood tests and different measurements that you could take that might pay more attention to their metabolic health, and looking for metabolic syndrome or signs of insulin resistance that might well be contributing to somebody's presentation. And then, of course, one of the biggest aspects that's advancing, with trials ongoing worldwide now, is looking specifically at the ketogenic diet, or a very low carbohydrate diet, as an intervention for people with major mental illness.
Well, that was the fascinating thing that you make really clear in your book, is that there are so many mental disorders that are exacerbated by a high carb diet and soothed by a low carb diet.
Yeah, absolutely. And unfortunately, just the way modern medicine has evolved, there's not necessarily an awareness of that amongst clinicians more generally. So it tends to just be the kind of relatively small number, although growing number, of clinicians worldwide who do have an interest in this, and do realize that there are very clear connections between somebody's lifestyle and what they eat, what we put into our bodies, and the development of mental health symptoms or mental health disorders.
Yeah, I mean, that it's, when you look back in hindsight, when you sort of look through this lens, it's, for me, it's like a light bulb. It's like, of course, it's like what we're putting in our bodies are going to have a huge influence, whether that be through what we're putting in our mind mentally, or in a food sense, nutrition sense, or in a light sense, will have a huge knock-on effect in how we use energy, are able to utilize energy, and how we think and how we feel. Everything in between is all a result of what we decide to ingest. So you mentioned also that you have clients, or you've seen clients or patients who have managed to pinpoint exacerbations in their psychiatric disorders down to individual plants or individual items that they ingest.
Yeah, and I must say it's not actually within my NHS practice, because that's still a work in progress. So because I work in a crisis team, I tend to have only very short-term contact with people, so maybe once or twice, or they might be under the care of our team for a few weeks at a time. But otherwise, I have some other forums. Obviously, I'm in touch with other psychiatrists who have used these interventions with patients, but also I speak at various forums in relation to this topic, and come across people regularly within those settings. But also people contact me directly to tell me about the arguably remarkable, I can't think of the right word, I was going to say revelation, but the improvements in their mental health across a whole variety of different disorders, just by changing their diet. And I do have some people in my personal life, and people I do know personally, who I don't necessarily know from having treated them within the NHS, but they have come to me, and they've clearly managed to resolve their own issues with anxiety and depression by making changes to their diet. And some of those people, it might be adopting more of a paleo type diet, not necessarily a full-on low carb diet. But what you tend to see is that once people go down that path, I quite often think you find that often people just go deeper and deeper into the science, and then want to try out different dietary strategies, and ultimately end up very low carb, if not keto, and some of them ultimately carnivore. So
and do we know some of the underlying mechanisms of why sort of carbohydrates or sugars are having this impact on our psyche?
Yeah, absolutely. So a lot of that I cover in the book, and I try to put the different pieces of the puzzle together, because I think it is very complicated, and there are multiple body systems involved. But essentially what I tend to think about is inflammation is a huge player in this. And we know that high carbohydrate diets are inflammatory in themselves, and they do lead to a level of cellular inflammation, inflammation at a cellular level, and something called hyperinsulinemia. So high levels of insulin over time is very detrimental to the brain and the body more widely. So then you get into the subject of insulin resistance, and what comes with that tends to be brain energy deficits. So probably the most research out there is to do with Alzheimer's, dementia, but with some researchers referring to it as type 3 diabetes these days. But we do know that other disorders such as bipolar disorder and depression, even anxiety disorders, there's evidence out there that insulin resistance is much more common amongst those kind of cohorts of people. And the fact that a ketogenic diet or a very low carbohydrate diet can reverse insulin resistance and reduce inflammation at its very core is really the underlying reason why those sorts of diets can be helpful.
And there was two other things that kind of stood out to me, which was that a lot of the medications that people are having to treat, sort of, I don't know whether they're SSRIs or other antidepressants or other psychiatric medication, is actually exacerbating insulin resistance in itself.
Yeah, so probably the biggest offenders in the psychiatric world are the antipsychotic medications, particularly the more modern drugs that tend to be worse for weight gain, are directly implicated in causing insulin resistance and diabetes. And in fact, some of the studies show that insulin resistance as a direct result of taking these drugs happens as quickly as within a week of starting the drug. And then, so something that I kind of really surprised me when I was going through the literature, but one thing that always sticks in my mind is about bipolar disorder and how people with rapid cycling bipolar disorder are much more likely to have insulin resistance than not. And then quite frequently in everyday practice in psychiatry, we tend to put people on mood stabilizers that in themselves may not be too bad in terms of metabolic health, but quite frequently you see that people are also treated with antipsychotics that will themselves result in insulin resistance. And some of the studies have shown that people on lithium are more likely to respond if they don't have insulin resistance, and you're more likely to be a rapid cycler in bipolar disorder. And that just means having more episodes of illness. So a rapid cycler typically would have 3 or 4 episodes of bipolar relapse in a year, and that's much more likely to happen if you have insulin resistance. So it just doesn't make a lot of sense to me as to why we would be adding in other medications that make the underlying possible pathological basis for that disorder worse.
But that's only been identified since people have started to make this connection and this look. Presumably there wasn't the studies and the research before to make that connection, or this is kind of willful ignorance.
I think the research has been out there. I forget the exact date of that one particular study looking at rapid cycling bipolar and insulin resistance. But I think a lot of the research has been there for quite a number of years. It's just not, it hasn't been presented at any mainstream conferences, kind of psychiatric educational meetings that I've been to. There's not an awareness of it in mainstream practice. And I don't know exactly why that is. I have my own personal theories on it, but I don't know for sure. And I think part of it might just be the influence and focus on pharmaceuticals in shaping mainstream education.
Yeah. I mean, I can see that. I mean, there is so much focus on pharmaceuticals, and it seems like nearly every disease, accumulative disease, is made wholly better once you look at diet and exercise and nutrition first. And then on from there, if that doesn't soothe the issue, then you should start looking at maybe the pharmaceutical interventions. But we completely reverse. It's like pharmaceutical intervention, try and deal with all the side effects.
Yeah, absolutely. And I think services are pressured, and there's never enough beds anywhere. and the emphasis is always get people treated as quickly as possible. And a lot of the lifestyle interventions, they don't necessarily work overnight. So I do know that people can have very quick resolution of symptoms. Some people, you know, within a week or a couple of weeks can notice improvements. But I think because there's not a wider awareness of those treatment options in mainstream psychiatric practice. And so I think automatically the focus goes to kind of heavier duty type medications that I have definitely seen them help people, and medications can help in the acute situation to get somebody out of a mental health crisis. But it's often when you stay on those medications longer term that you then subsequently run into difficulties in terms of metabolic health. And I suppose the easiest option is to just tell somebody to keep taking a medication, as you know, if they've been acutely unwell, have recovered, and then stay stable for a while. But I would really love to see that change.
Yeah, I mean, I've heard of the ketogenic diet is fantastically effective at treating either a certain type of epilepsy or some forms of epilepsy.
Yeah,
And
yeah, and
sorry,
that's where
go
a
on.
lot of the research has come from, I think, in the last 100 years, in terms of its use in treating epilepsy. I
But
don't think it's 100% in terms of epilepsy, but I
mm,
forget the exact figures. It's a fair proportion that can respond.
yeah, and I know, but I've heard of a patient or a patient's parent coming to a doctor and saying, "Hey, look, I've read all this stuff about the ketogenic diet and how it could help. But you want to put him on this medication first. Like, can we try the ketogenic diet first?" And he said, "Oh, well, it's sort of dangerous to do the ketogenic diet because he might deviate from his ketogenic diet." But then it's the same rationale as what if he deviates from his medicine? It's
Which people do all the time, all the time. I forget what the quoted studies are in terms of how many people actually take their medication 100% of the time, but I think it's not very much.
yeah, it's
And I certainly see that in my line of work day in and day out, people relapsing. And the thought is that they've relapsed because they've stopped medications. Although there's another school of psychiatry. So I'm a member of the Critical Psychiatry Network, and there are often various emails flying around in different opinions. So there are some psychiatrists out there who feel that people who experience relapse, some of that might be attributable to withdrawal symptoms from medications and not necessarily a genuine relapse of a mental disorder. I can't really comment either way. I suppose what I've seen in practice is people tend to relapse fairly typically for them. So if you've had an episode of illness once, what tends to happen is you might tend to see the same symptoms come back again. And quite often it's the case that people have stopped or have only been taking their medication intermittently. And who knows really what that's doing at an underlying cellular level in terms of the metabolic health and their biochemistry and what's going on there.
Well, exactly. I mean, there's no way that would even be able to be researched. Intermittent medication taking and up and down. I mean, it's just the only thing you can see is what's been researched and see if that works in practice for the individual, and then that's kind of the best you can do. But in terms of the actual science behind keto and ketosis, like we know that insulin resistance and poor metabolic health can lead to an exacerbation of mental disorders. So why does the ketogenic diet help that?
So I think it helps on a number of levels. And I always think of it as the ketogenic diet essentially treating many of the underlying causes of mental disorder. So I went through my training thinking that people had mental disorders because they had adverse childhood experiences or trauma in their history, or they had a family history of a particular mental disorder, and then there was a certain inevitability that that person might then experience depression or bipolar disorder, whatever the diagnosis might be. But actually, I think increasingly we're coming to know that the all of the research that's out there is pointing towards the fact that there are common underlying mechanisms for mental disorder at a cellular level in the body. So where to start? So the gut-brain connection is a huge one. And I think there's still a lot that we don't know yet about that, but there's a lot that we do know. And the problem with some of the research is it's in animal studies, and then you're coming up against the difficulties in mainstream medical practice where people want randomized controlled trials of interventions, and we don't necessarily have those yet, although I think they're on their way, and a lot's happening in that field now. But yeah, there's certainly an overwhelming amount of evidence, I would say, in terms of supporting the underlying mechanisms for mental disorder. And the more modern way of thinking about it is gut-brain connection, levels of inflammation, levels of oxidative stress in the body, and then the insulin resistance that can result. And the ketogenic diet can address all of these issues. So we know that when you convert from being a sugar burner, so burning glucose as your main energy source, when you switch over your metabolic machinery as such to burning fats or ketone bodies, that there are anti-inflammatory effects that happen in your cells, and there are certain pathways that are altered. So neurotransmitter pathways are one of the pathways that can be altered in states of inflammation, but also when you're ketogenic or in a nutritional ketogenic state. So
presumably altered in a negative way that makes it
for inflammation, yes.
Okay.
So there's a certain neurotransmitter pathway that's called the kynurenine pathway, and that's to do with tryptophan metabolites and the conversion of tryptophan into various different neurotransmitters. One of them is glutamate, which is an excitatory kind of stimulatory neurotransmitter, and the other one's GABA, which tends to balance glutamate out. So GABA tends to be your relaxation neurotransmitter. And we do know that that particular pathway can be tipped out of balance in states of inflammation and oxidative stress. And you end up having more of the glutamate produced, and you get something called glutamatergic excitotoxicity. So
wow, good job.
too much glutamate, it essentially just makes your brain continuously fire and be in an alert state, and leads to agitation and brain fog and all those sorts of issues. And then you get less of the relaxation neurotransmitter. And we know that a ketogenic diet shifts the balance of that pathway back to kind of normalize it, essentially. So you have more of a balance of the neurotransmitters that you should have. Having said that, I don't want to place too much emphasis on neurotransmitters, because I think that's been done to death in terms of all the medications, and I think it's very overly simplistic to think it's just about those. I think they're a piece of the puzzle, but by no means the biggest piece of the puzzle.
Yeah. Well, I mean, there's so much connection. I mean, I was talking to Natalie E. West. She's based in Australia.
Oh,
yeah, and she was the first one who kind of presented this idea to me that 90% or 80% of the serotonin and dopamine that we have and our neurotransmitters are made in the gut.
Yeah.
And that's just mind blowing, because previously I think it's like you take a line from the bottom of your chin and you're like, that's where all the neurotransmitters are made, and that's where all the synapses are, and that's it, and then job done. But it's so much more detailed than that.
Absolutely. And I don't know that I can't actually remember, until I did functional medicine in the last few years. I don't remember if I went through the entirety of my psychiatric training not necessarily knowing that fact, because it was astounding to me when I revisited that. And I just honestly can't recall if it was ever mentioned in my training up until that date. But I think I always had this idea that your neurotransmitters are in your head and in your central nervous system, and they're not anywhere else in the body. But yeah, the vast majority are produced and reside in your gut, and that's why gut health is key. There's lots of studies out there showing in different psychiatric populations that there are differences in terms of the gut microbiome, so the balance of bacteria in the gut, and dysbiosis is a big thing. And I think there's going to be more on that in the future. There's just a lot that we don't know yet, but we do know that the gut and the brain communicate in a two-way communication with each other, and the health of one can influence the health of the other.
Yeah.
And it makes sense when you think about having a gut feeling. There's all these sayings.
Yeah, butterflies, gut feeling, all that
well,
stuff.
yeah, and why would you get kind of butterflies in your stomach and diarrhea before a big exam or test or whatever it may be, without there being a direct connection?
And I've heard that when we're in this, I'm pretty sure this is correct, but when we're in fetal development, the first thing to develop is your central nervous system. And then from there, your sort of your digestive system starts to form at the sort of same time as the sort of brain starts to form off of that central nervous system. So they are one and the same. They are equally as important.
Yeah, and I can't remember a lot of that stuff going back to medical school, but I have been meaning to go back in and revisit that, because I think you do start to see clear connections, and you see that very different parts of the body have evolved from the same origin, essentially, in terms of fetal development or embryonic development. And yeah, that's fascinating. And so I think it's just been artificial how we've separated everything over the years in terms of how modern medicine has evolved.
Yeah. And I'm going to jump over to the other side of the fence, and I'm going to play devil's advocate for 5 minutes and just ask you, how do we know that it's carbohydrates causing the issue for metabolic health and mental health, and not the fact that your patients who are displaying with these mental disorders are just soothing their mental disorders with more carbohydrates?
Okay, so I don't think it's just carbohydrates. So sorry, my immediate thought goes to seed oils and the vegetable oils.
Yeah, we can touch on that too. Please tell us about how that part of the picture links in as well.
So yeah, I mean, I just think industrial seed oils were just never really meant to be proper food for us or nutrition. So they're kind of a relatively recent introduction in terms of the human diet, and just not very evolutionary appropriate or ancestrally appropriate for our diets. And there are studies showing that the omega-6 to omega-3 ratios in the human body are relevant and are often out of balance in particular mental disorders. There's certain disorders such as ADHD and autism, where there have been studies showing that children with those disorders have different ratios of omega-6 to omega-3 to other cohorts. And the vast majority of omega-6 in the modern day diet comes from industrial seed oils. That should, in my opinion, never really had a place in proper human nutrition.
And we can name a few of them. It's sort of like corn oil, rapeseed oil, canola,
soya oil, sunflower oil,
rapeseed oil.
They're prolific. They're just in absolutely everything.
Well, they're super cheap.
And every fast food outlet's frying their chips in this stuff, and the omega-6 fatty acids that come from those oils are highly inflammatory, and they're essential. So we need a certain amount of them, but nowhere near the amount that is in our modern day diets. And so I think our ratios are meant to be about 1-to-1 of omega-6 to omega-3. And I think we're at least 10 times over the omega-6 ratios, if not more.
I've heard some people are in the 30s, 30-to-1.
Yeah, I've seen various figures for it. So we're getting things very wrong that way. And I do think that those oils are implicated in the development of insulin resistance. And I know there are various opinions out there, and I don't know that I could do the arguments justice just now, because I've heard various opinions, probably more so from people wanting to defend their ongoing carbohydrate intake. So some key people in the kind of health world who want to defend carbohydrates, and they tend to put all their eggs in the basket of it's all the seed oils and vegetable oils and carbs are okay. But I think there are many more of us who are saying that actually it's both that are an issue, and that's certainly the camp that I would fall into. So yeah, just coming back to your question about mental disorders and which is the chicken and which is the egg. I don't think people would get better when they eliminate carbohydrates from their diet if it wasn't the carbohydrates that were the problem to begin with. I think we're just metabolically sick and unhealthy as a nation in most places, and certainly people removing vegetable oils would go some way to correcting some of that, but it's this hyperinsulinemic state that you get into where your body naturally will produce insulin in response to intake of carbohydrate, and having chronically high levels of that and snacking all across the course of the day, not doing any sort of fasting between meals, all of that contributes to high insulin levels. And it's really persistently high insulin levels that would concern me in relation to underlying mental health.
And that's essentially what happens there, is that we're having, because the insulin is no longer effective, the cells are no longer responsive to the insulin, and therefore the sugar remains in the bloodstream and cannot be utilized. So essentially the brain and everything starts swimming in sugar.
Yeah, absolutely. So your brain will have a constant proportion of glucose there relative to your bloodstream. And if your brain's insulin resistant and can't use the insulin, then your brain cells will be swimming in glucose but unable to access that energy, because they need the insulin to be effective to access the energy from glucose. And so the beauty of a ketogenic diet is that when you switch your body over to being able to use ketone bodies as fuel, they can cross the blood-brain barrier and provide a very clean source of fuel, and actually more energy per unit than glucose. So you can end up refueling your brain essentially from using ketone bodies. And while you're still in this insulin resistant state where your brain's not really able to use the insulin that might be there.
And well, that's one of the categorizations of I want to say metabolic syndrome, is that total metabolic inflexibility, that even though the fat is there, we have the body is not primed enough to even access those stores, hence why, you know, accumulation of fat stores and the always default mechanism of energy choice, glucose.
Yeah. And there are certain areas of the brain where it can only run on glucose, but we know that your body can produce all the glucose that you need, essentially, because there are people who survive. You know, I do a 0-carb diet myself, so I don't include any carbohydrate, but my body is perfectly able to produce the glucose that it needs to run every single day, and that
Still
doesn't
alive,
need to come
still
from an
here.
exogenous source. Sorry?
Still alive, still here.
Yeah, still kicking. So.
Yeah, I think that's fascinating, isn't it? And I think there's a lot of misunderstanding around what carbohydrates do once they're in the body and what they ultimately end up as. And the understanding that, certainly the evolving understanding, is that every carbohydrate ultimately becomes a sugar in the body. And that ultimately feeds on to, if you have a volume of them in the body, then that's going to ultimately impact your insulin response. And if you're trying to be in ketosis, kicking that out of ketosis, because we have this view that anything that's vegetable based, apart from seed oils now that we've talked about, is healthy.
Oh yeah, and I think it's a really flawed view as well, but just everywhere it's pervasive, that view, and it's very difficult to go against the grain, for want of a better phrase, and have a view that opposes that sort of mainstream narrative. But yeah, I absolutely agree. I tend to be a simplistic thinker about things, and I often find myself thinking, well, how can health authorities come out and say that sugar is bad for you? And there's a certain amount of acknowledgement that sugar is bad and people shouldn't be basing their diet around sugar. And yes, they push whole grains on people. And I just essentially look at nutritional labels and look at the total carbohydrate count and think, well, that's just the sugar count, isn't it? Because your body does digest those complex carbohydrates down into simple sugars, like the monosaccharides.
Well, that's a great thing that you mentioned, is that, and it clicked with me as well when I read it. I was like, of course, because we shouldn't just look at the total sugar content. We should look at the total carbohydrate content, because they are one and the same. And what we get taught in school, in biology or whatever, if you were lucky to have a nutrition class in school, no, I don't think they do. Then we see it as carbohydrate sugar and carbohydrate starch.
Yeah.
Which is just like the same.
Yeah, and you look at the roles of the different macronutrients in the body, and there are many essential roles of well, maybe essential is the wrong word, but there are many roles that fats and proteins satisfy, you know, such as creation of hormones and the building blocks of muscles and different tissues in the body's bone. But carbohydrate, all it does is provide energy for the body, and there is no other essential role within the human body for carbohydrate, exogenous carbohydrate.
And I just want to clear up, like, carbohydrates aren't going to give, like, a small level of a small or medium level of carbohydrates are not going to give everyone a problem. Is that the
No.
case, or like, where's the line
Um,
here?
yeah, I mean, I'm a big believer in bioindividuality, and I think people who are physically active and do a fair amount of exercise and so on, they can get away with including more carbohydrate in their diet than the average sedentary, kind of metabolically unhealthy person. I think for mental health, from what I've seen and what I know of the literature, I do think that some people might need to more tightly control their ketone levels to be able, so some people might need to be more strict regarding their carbohydrate intake.
For
But
people
that's
who
not
are
to say,
looking to get into ketosis.
yeah, but then that's not to say that, if you're a huge exerciser, then your carbohydrate threshold is going to be a bit higher than somebody who's more sedentary. So I think there's nuance there. I think that carbohydrates are an ideal food source for people. I don't think they're nutrient dense. And from what I've seen and know, I do see that carbohydrate foods can cause problems in some individuals, but not necessarily everyone. So there are anti-nutrients within a lot of the kind of plant foods that are problematic from people, from what I see and what I hear from others.
Yeah. And can you give us some examples of those?
Yeah, so there was a recent, so one study that I looked at recently looked at a gluten-induced psychosis in a teenager. And so there is a published case report out there, and it was very clear. And they showed that, I think it was a young girl around the age of 14, and she developed a frank psychotic illness in her teenage years that was treated by psychiatrists. And then they did food allergy or food intolerance testing on her and found that she had a gluten sensitivity. And when they removed gluten from her diet, her symptoms resolved. And so they decided to go back and do a double-blind re-challenge test using gluten in a pill form and some sort of starch as the placebo pill form. And they were able to show in the study that the gluten in the pill actually provoked psychotic symptoms again, and the girl's psychotic symptoms returned, whereas the starch pill didn't do anything.
Wow.
And so my memory of the study is that the girl just followed a gluten-free diet and was okay after that. So that's one example of a grain
Wow.
causing like a huge issue in terms of somebody's mental health. But I do know others particularly within the carnivore community, who talk about some people being so sensitive that even including spices in their meals can end up precipitating mood symptoms or symptoms of depression for them. Whereas there are other people who do keto and can include some plant foods within their diet, and they don't necessarily have that sensitivity. So I think there's a lot that we just still don't know yet.
Yeah, I think, and if you extrapolate that on a population-wide level and say that it's not all going to be schizophrenia and it's not all going to be like the extremes of mental disorder, but there will be other plant chemicals. It's just gluten that will want plant proteins or phytochemicals or however you want to categorize them that will have these impacts. And so whether it be depression or anxiety or bipolar or anything in between, then because I mean, I remember reading a little bit about when you're watching on a population-wide level, the diets change of a population, and one focuses on Papua New Guinea, and schizophrenia, cases of schizophrenia increasing as their diet changed to a more Western style of diet. And I guess that would be the standard American diet, with more processed foods and grains and flours and things with a long shelf life. And I guess with the seed oils as well. And you can look at the populations like the UK and the US and these other populations that have had that long entrenched diet having increased levels of schizophrenia.
Yeah, absolutely. And I can't quote all the historical stuff off the top of my head, but it is there when you go back and look at the rates of disorders. And certainly the rates of all mental disorders are increasing and have been. Dr. Georgia Eade has a really nice presentation online where she goes through in a graph form in terms of the rates of mental disorder and the kind of exponential increase in those alongside the dietary guidelines that came out in the 70s and early 80s, and the rates of type 2 diabetes and obesity and essentially markers of deteriorating metabolic health, which seem to coincide with the rates of mental disorders increasing.
Well, that's the thing, but lots of people push back on that and they say I think it was Lane Norton. I don't know if you've come across him online.
Don't think
He
so.
loves trying to rip people down on Instagram.
Okay.
So you know, and he
Watch out
particularly
for
hates,
that.
but yeah, he particularly hates Paul Saladino. So
Oh, okay.
lucky he takes all the heat. But you know, Lane Norton is saying like, but nobody follows the dietary guidelines. Like, I don't know
Yeah.
anyone who follows the dietary
Mm.
guidelines.
I think if you just look around your average supermarket, every day I go in, I it never ceases to amaze me. You see people who are clearly very metabolically unhealthy, they're morbidly obese, and then their trolley is full of whole grains and fruit and vegetables and low-fat yogurts and things. And I think these people are trying. And I'm sure I've heard Sean Baker quoted in terms of saying there are studies that show people do on average try to follow government guidelines.
Mm. But
So,
that's self-reported versus
yeah.
reality.
Well, yeah, I mean, I'm not really a believer in terms of epidemiological research when it comes to nutrition. I think
Yeah.
there are many
Yeah.
flaws that you can pick in that. So,
Yeah, it's a, and there's so much healthy user bias out there. Like
oh
the
yeah.
people that are studying, that are
Mhm.
making the healthy, you know, like the very fact, like all of these studies that say red meat is causing cancer or so, but everything in the red meat section, or the red
Yeah.
meat states, are having like pizza that's with pepperoni, that's counted as
Uh-huh.
red meat.
Yeah.
And you know, sort of bacon flavored crisps, that's
Mhm.
started as red meat. And like, whereas the vegetarian group, who are ultimately, vegetarian and vegan group, are ultimately going to be more health conscious anyway.
Yeah.
They're going to be
Yeah.
either supplementing, they're going to be taking exercise, they're going to be doing meditation, they're going to be doing everything else that makes us
Mhm.
healthier. But
Mhm.
you've lumped all of the definitely unhealthy people in the meat eating group.
Yeah. Yeah, absolutely. The risk takers and the people who are going to be smoking and riding a motorbike and all that kind of stuff. Yeah,
Yeah.
absolutely. It's
So
crazy, I think. And yet people get so almost like dogmatic about this stuff, almost to the point of being religious about diet, and they don't want to hear that maybe the state of the research that's out there isn't really all that telling or representative. And
yeah.
it just applies to so many things. I think even a lot of our blood tests that we have and the reference ranges, they just apply to standard population who've been eating a kind of sad diet,
Yeah.
essentially.
Yeah.
So
So yeah,
yeah,
you're in the average range, but the average range is so low and so poor.
yeah,
But we're not going to
yeah,
tell you that.
yeah, exactly, exactly. So yeah,
So
just don't believe everything that you hear because I think there's so much that we don't know.
yeah, I think a lot of people are prone to selective hearing.
Hmm. This is
Uh,
true.
so I want to come on to, we've talked a little bit about insulin resistance, being metabolically unhealthy, why keto might be better for our mental health. And I want to go a step further, and I want to talk about why a zero carb and a meat-based diet is better for our mental health, or can be for people with mental health
Yeah,
issues.
yeah. So yeah, I've been in the kind of carnivore community for coming up for 4 years, so about 3.5, 4 years now, and I never would have believed it myself. So when I first heard about carnivore, I thought it was the craziest thing ever. But I heard it from a very well-respected keto influencer who was trying it themselves. And then just in terms of the level of knowledge that person had, it made me stop and think. And I thought, okay, this sounds absolutely crazy, but maybe I need to look into it more. And when you start to look into it, there's just so much about it that makes sense. So animal foods are the most nutrient dense foods that we have. And in terms of an ancestral health perspective, there's lots of really good podcasts out there talking about the ancestral perspective and where we've evolved from. And essentially, we are meat eaters, and that's what we've evolved from. But I'm a really big fan of Dr. Anthony Chaffee. I'm assuming you might watch some of his stuff
Yeah,
too.
he's been on the podcast. He's
Oh,
done his
okay.
return session, but that's going to be out in actually it will have come out just before this podcast actually.
Okay. Okay. Excellent. I'll look forward to
Yeah, he's
watching
great.
that.
He's great. He's
Yeah,
fantastic.
and he's so knowledgeable about things as well. And oh gosh, I've forgotten my train of thought's gone now. But I
About
know that
what,
he,
why a meat-based diet is better for our mental health.
yeah, I mean, I think it's the ultimate elimination diet. So
Mm.
you're eliminating all of the potential allergens and It makes it really easy to pinpoint any food intolerances that you may have, particular issues relating to oxalates, or even just individual food sources such as pasteurized dairy and those kind of issues. So I think essentially it's the ultimate anti-inflammatory diet. And I know that for myself, from doing my own lab testing, I can hold that up and say I've done inflammatory tests and on carnivore, and it's been virtually non-existent in terms of your HS CRP readings. But I know others in the carnivore study that Sean Baker had been involved in have experienced similar. So inflammatory markers tend to go down. And in practice, you do see that people improve across a whole range of different disorders. So not just mental health, but different inflammatory disorders, like arthritis, for example, and autoimmune disorders, colitis, all sorts of different health parameters do seem to be able to improve with a zero carb diet.
Well, the whole issue with food intolerance versus immune system, from my understanding, one is kind of a chemical reaction in the gut for a food intolerance, and one is an immune response, like cytokines and everything in that sense. And if we have a low hum of immune response, then that will ultimately manifest in immunological disorders. So, and most of that seems to be coming from the sort of foods that are kicking off those immune responses.
Yeah, absolutely. And we know in mental disorders that there is an immune response that is part of it as well. So I hadn't mentioned that earlier, but you do get activation of the immune system in different forms. So like NLRP3 inflammasome is a part of the immune system, and there's clear studies documenting activation of that in mental disorders. But astroglial cell activation, there's all sorts of immune cell involvement in terms of the inflammation and crosstalk between the immune system and gut health and metabolic health and mitochondria. We haven't even talked about mitochondria, but that's in the mix there as well.
Yeah. Well, that was a fascinating thing, that some of the amino acids that we only get in meat, and I don't know whether it's only red meat or only ruminant animal meat, but certainly things like taurine. And we have genes within our DNA that are specially geared to react to taurine. And having a presence of taurine in the diet can turn on gene expression, and an absence will turn off that gene expression. And one of the sort of, I mean, I've written a list of some of the genes sensitive, and it's related to cell signaling, cell survival, amino acid metabolism, protein synthesis, aging. Like, all of this is intricately intertwined with amino acids that are only available in meat.
Yeah, and that's epigenetics that you're talking about. So and I just think that's absolutely crucial. And I went through training thinking that if somebody had a family history of a certain disorder, that there was almost an inevitability that they were going to go on and develop a mental disorder, whereas actually my thinking now is that it's mostly about environment, and genetics is a very small component. And so what we put into our bodies does affect what genes are switched on and switched off. So there are epigenetic effects. And I think one of the first people who gave me that awareness was Mark Sisson. So I've been a huge follower of Mark Sisson for many years. I'm a Mark's Daily Apple and love all of his books. And I think he was someone who expressed that all very well in his writings.
Yeah, he's in great shape.
Yeah, absolutely, isn't he?
Ridiculous.
If anyone's a walking testament to what diet and lifestyle can do for you, kind of even as you age, then he's one of them.
Yeah. Well, he's about to hit 70 now, and I think he's
Wow.
he's not slowing down. 69, I think, the other day. I don't know whether I Googled a couple of months ago, but I don't know when his birthday is, but he's about to hit 70.
Gosh.
And like,
I mean, in my head, he was even younger than that. So yeah, that's amazing.
It's crazy. It's crazy.
Yeah.
So,
but I mean, I talk about it in my book. There are certain nutrients in meat that you don't really get in other things, and like carnosine and carnitine are other ones, and they do reduce oxidative stress at the level of your neurons. So there's some really exciting research out there showing just why animal foods are so important for mental health. And I know people can do a keto diet being vegetarian. I think vegans possibly a bit more problematical. I think Thomas DeLauer may at one point in time have had a video out about how to do a kind of vegan version of keto.
How would you do that? Do you know
Well,
any of the main preeminence of that?
No, I wouldn't recommend that to anyone. It's kind of why I mention it, because I do think you are missing certain nutrients, and I think
Mm.
that's kind of what we were touching on there.
Yeah, well, that's the thing. I mean, you know, I had Dr. Peter Ballestead on the other day, and he was talking about the amount of lysine that you can even get in sort of beans and rice. The size of a 9-year-old's stomach is not physically big enough to take enough beans and rice to get enough lysine into his body for
Yeah,
his growth requirements.
yeah, yeah. And you see some horror stories, don't you, about children who haven't developed very well, or who've come to frank harm from following
Yeah,
vegan diets.
yeah,
Um,
it's crazy.
yeah,
It's crazy.
yeah.
So,
My heart always sinks when I see a patient and they say that they're vegan, because yeah, I just
what
it's
do you
always so
say?
hard. It depends on the situation. So I had somebody recently who was in a real crisis and suicidal, and there was all sorts of stuff going on for them socially in terms of stressors, and they were there with their partner, and then they were both so proud in terms of telling me that they followed a vegan diet, and they just seemed so invested in it. I just had to make a judgment call at that point in time, and I didn't say anything about the vegan diet because I thought this just isn't going to go down well, and I don't really know how to introduce it. I think it's about being the right time in the right
Mm,
place.
yeah,
But
yeah.
yeah, there was a part of me, I think, with that person, I thought maybe their whole world's going to implode at this point in time if I
Mm.
say, actually, I think you should think about changing your diet, because maybe that was one of the main things positive left in their life at the time from their
And,
point of
and
view.
and because you were in the crisis team, you didn't see a follow up of them. You don't know what.
Yeah, no, so I didn't see them again.
Oh, that's such a shame.
But we do get people who come back,
Oh.
more than once. So that could
Mm.
change. It's just, yeah, it's difficult because there can be some downsides to keto when you're transitioning. So it's important to get the right support, I would say, and pick the right time to transition into keto if it's for major mental illness, because
What kind of downsides?
so sometimes mental health symptoms can worsen. So people can have relapses and have their symptoms deteriorate. For example, in bipolar disorder, there can be a risk of kind of manic relapse, for example, or exacerbation of depression. And I think it's just when people are transitioning through that withdrawal period from carbohydrate, and we always call it keto flu, but I like to think of it more as carb withdrawal.
Mm.
Um, and
Almost like a food
yeah,
addiction.
sorry.
Almost like a food addiction or a sugar
Oh, well, yeah,
addiction.
for sure. So, yeah, I'm a big believer in food addiction, or more specifically, sugar and carb addiction.
Mm.
So there's good evidence out there showing that you do get a dopamine response in certain areas of your brain
Mm.
when you consume sugar and carbohydrates. And I consider myself to be a sugar addict, so I feel like I have firsthand experience of
Still
what.
now, I suppose once an addict, always an addict.
Um, well, yes and no. So yeah, it's interesting. I do wish that years ago I'd had more awareness of this and actually had known more about it being an actual addiction, because for years I thought maybe it was an emotional eating type issue that I had. But carnivore in particular has just made all of that go away, and just have no preoccupation with food whatsoever. It's just been a very natural sort of
Mm.
relationship with food, as it always should have been.
Mm.
um but I do, like, now and again I have tried a mouthful of something sweet that maybe my son's been having, and I do actually actively dislike sweet taste now, so my taste
Really?
buds have
Wow.
changed. Yeah, it tastes fairly disgusting to me.
Does it taste too sweet? It's like having a super sweet chocolate cake, or it's
Yeah,
actually like you're repulsed by it.
a bit of both, really, I
Mm.
would say. So it just tastes so unnatural and so different to anything else that I've been eating. It's
Mm.
like it's sickening. It's that sort of experience.
Would you? What about from like a piece of fruit rather than like a chocolate cake? Because a chocolate cake, because I've done the same thing. I've been away for carbohydrates for a long time, and then I go back to it, and a banana will be delicious, but a piece of
Oh,
chocolate cake, a synthetic piece of chocolate cake, or as like a chocolate bar from the shop, will taste. Oh,
yeah, so I haven't really done any fruit, admittedly, but I do think I would find a banana particularly sickening. Like, I just do not fancy having a banana at all. Um, what have I tried? So, like, a mouthful of vanilla ice cream, or a tiny piece of just your bog standard milk chocolate that I used to love, and had many a time as a teenager and in my 20s and so on. But just I find myself recoiling at how sweet it was and thinking, how on earth was I doing that? I suspect I could probably eat berries or strawberries, and maybe even strawberries would be too sweet though. I don't know. I haven't tried it. I'm thinking out loud.
Yeah, yeah. Well, I
Well,
mean,
I what I would say is, although I actively dislike sweet tastes, I do, however, still think that I'd still have a sugar addict sort of reaction if I was to integrate more of that into my diet.
it
So
would
if I was,
escalate and you
yeah,
wouldn't, yeah.
I do think that. And I say that because I went to a Rodizio, like kind of Brazilian barbecue type restaurant, and they served me some pork, and I hadn't realized it had been cooked in honey.
Mm.
And a few mouthfuls of that, and it was amazing. And then I found myself just being like, I need to get more of that pork, and
Relapse.
bring me more. And then I just thought, oh, this isn't good. Like, I don't feel like I this way about all the other meats. So I thought I
Yeah.
would have to watch myself with that.
Those Brazilian restaurants are great though, where they keep coming over and
Oh,
carving off
yeah.
meat to you. That's like, that's it.
Yeah.
That's a carnivore's dream, unless it's
Yeah,
covered in honey.
absolutely. I
So,
agree.
so yeah, because I've just come to the part in your book about halfway through where it's just starting to talk about food addiction, and you mention I think it's Bitten Johnson,
Hmm.
and I've made a note to go and do a bit more research around her, because it makes total sense. I mean, because many people argue that sugar is not addictive, and it's just down to choice.
Yeah, that's just nonsense, I would say. I think there's definite research that shows in animal studies anyway about dopamine responses in the brain. And there's a study I remember looking at rats, and they have cocaine addicted rats. They put in a study, and then they offer them, they've got little pedals they can push to get more water. And it's either cocaine fueled water or sugar fueled water. There was actually a sweetener fueled one as well. And they choose the sugar water time and time again
Oh wow.
over the cocaine, and escalate their use and their dose that they're taking in, just
Maybe
in the
they were
manner
just
in
very
which.
health conscious and they didn't want the cocaine.
I suppose that would be the argument, wouldn't it? But
No,
yeah.
that is fascinating. That's
Mhm.
fascinating. And there's loads more stuff we could talk about, and we're kind of
Mhm.
coming out to time now. But like there's so many things that people deviate just to the medical option rather than looking at diet first. I mean, reading also about statins that affect some of the other neurotransmitters that we also get from meat, and they lower them, and
Okay.
make it harder for our brain to get the right amount of cholesterol that we need.
Yeah.
And then, so
Mhm.
although you might be lowering, I think statins are for blood pressure.
No, for cholesterol.
For
So
cholesterol. Okay, so you're
yeah.
lowering the cholesterol, and you're also
Mhm.
having this knock-on effect. We need cholesterol. We need
Well,
cholesterol
yeah,
for our brain.
it's a building block of like almost every cell in the body, and but the brain especially.
It's
So yeah,
crazy.
it makes not a lot of sense to me, that one.
It's crazy. It's crazy.
Mhm.
But where can it's been fantastic to talk today. I think we could talk for a lot longer, but
Likewise. Yeah, I
I
agree.
I'm curious, if you sparked someone's interest today, where can they find more information about you and your book and your work?
Sure. So I've got a website that I'm in the process of updating. So it's foodforthoughtpsychiatrist.com. And then I'm on Instagram mostly. So as Carnivore Shrink on Instagram. So people sometimes contact me there, and I try to put out different content there too.
Perfect. Rachel, thank you so much. Thank you everyone for listening. And we will hopefully speak again soon.
Yeah, I'd love to. Thanks so much for having me. This has been fun.